So my task here is to talk about European strategy for diabetes. First of all, I would like to start mentioning a very key instrument in trying to achieve the European strategy for diabetes. That is the diabetes policy puzzle. I want to call your attention because it's a new edition coming up next November. We will launch next November, and this new edition goes behind EU 27. The new edition will have data of the huge Europe, so 47 countries, and will include also some data from DIAMAP. From that, one of the key findings of that national plan survey, and I would like to call your attention because the 2011 number is not correct. I just put 13 to show that from 2007 to 2011 there is a very slow progress. So don't look at the 13 number as it is in fact. The data is still analyzed and will come up in next November. But we know already that only a very little and slow progress has been made since the year of 2005, which is very worrying, of course. It means that less than half of the EU member states have adopted a national plan, of course with different levels of implementation and evaluation. Okay, so this is very worrying. We need to do something about it, and very urgently. All our work at political level is pretty much based on this type of conclusions, resolutions. I would like to call your attention for the European Parliament written resolution and also for the UN resolution on diabetes. There are two key elements in our strategy to get EU strategy for diabetes. Also this European Parliament Diabetes Working Group, I will want to speak about more in a few seconds. And of course, this UN high-level meeting on non-communicable diseases, which is going to happen next week. And I got to read a sentence, because I just got an email in this morning about the latest development of the declaration of this meeting. It seems that the world leaders is now understand that the response of the governments on NCDs is inadequate, and the resourcing and political commitment is very, very low. This is excellent and gives us a good starting point to go from NCDs to diabetes at political level and EU and European level. Of course, that when you are talking about resolutions, we should start with this very important resolution or declaration. It's St. Vincent Declaration. It's over 20 years now, and it's still being used. We in Portugal we used it in the past in the several occasions. So one question can in our mind: if we have such a number of resolutions, conclusions, declarations, do we need another one? Does it make any sense getting a new one? Does these resolutions are improving the quality of care, the quality of life for people with diabetes? That's the major question. For me, the answer is yes and no. No, because these declarations are non-binding declarations, meaning that the declarations don't have a direct influence on people's lives. But yes, because all of these resolutions are key tools when you talk to a politician. Every time that we go to talk to politicians, we always remember the politicians. There is such declarations signed by the governments, part of them. So what do we want to achieve? We want to achieve an European strategy for diabetes based on the EU Council, so the European Council recommendation on diabetes prevention, early diagnosis and control. Okay? So we want to start on EU 27, but as soon as we get an EU Council recommendation, this will spread all over Europe, because EU is considered a model for other European countries. We have been working at two levels at EU institutions, so with the European Parliament and the European Commission, of course. And one of the key instruments in the European Parliament is the European Union Diabetes Working Group in the European Parliament. This is a discussion group organized by the European Coalition for Diabetes, which is comprised of EURADIA, FEN, so it's the Federation of European Nurses in Diabetes. Got it right, FEN? Yeah?
Okay.
Yeah. IDF Europe, and PCD is the Primary Care Diabetes in Europe. Okay? And it is organized by the ECD, but we have 4 co-chairs, 4 members of the European Parliament from different political parties, from different countries. There's one from Portugal, Denmark, UK, and Malta. And these co-chairs are helping us in organizing the meetings. This group holds meetings in the European Parliament 3 to 4 times a year, and in each meeting we discuss a specific subject, which could be related to public health, to research as well, to consumer protection and employment and social affairs, patient rights and safety. Of course, all these objectives have one aim, which is reach a EU diabetes strategy for Europe. On you as well, as I want to show you. This resolution is still on the draft stage, but we are aiming a resolution, twofold resolution. So we need to call member states to develop and implement and monitor national diabetes programs, lifestyle intervention strategies, develop disease management programs, and ensure continued patient access to primary and secondary care. Because this is the part of the member states, but also we want to call the attention for the European Commission to develop and implement the EU diabetes strategy for Europe, of course, improve coordination of diabetes research by fostering collaboration between academia, industry, and as well public and private funding agencies. And we need the European Commission to ensure continued support for diabetes funding under the current and future EU framework, or other name that you today. When it comes to health, as I told you, member states have the exclusive competence on health. The Lisbon Treaty is very clear on it. So the EU institutions cannot go to a member state and force the member states to change the healthcare system, to change anything in health. But the EU has an important role to play, because the EU institutions are key influence to member states. Of course, the EU may support and help to coordinate exchange best practices, of course. The EU must ensure continued support for research, which is on their remit. Also, the EU institution could encourage and development and implementation of national diabetes programs. And this is essential, this is key. I'm reaching my conclusions. I try to be very brief and concise. We are reaching the end of the day. We are reaching the end of a long day. So, we know that the prevalence and costs are still on the rise, of course, all over the world. We know that since 2005, only a little progress has been made in implementation of national diabetes plans, that's for sure. We know that without any intervention, inequalities who persist among diabetes patients living in different EU member states. If I go from Portugal to my neighbor Spain, there is a huge difference, for instance. If I travel inside Spain, depending on the province, it's different as well. So we feel that there is a urgent and difficult role to play in encouraging member states to act, and this must be done through a new strategy for diabetes that came from the European Union. Because without a huge strategy for diabetes, Europe will have a huge problem in their hands. Financial, human, all sorts of different levels. Okay? Because the situation as this is now is not good and needs to be improved in a very urgent manner. I did a very simple, to finish up, I did a very simple test to show the relevance or the importance of these declarations, although they are not binding, but they are very relevant in our daily work. I go into Google, and this is Portuguese, sorry, just to taste the least Portuguese, and I type in Symposium declaration. I got this number of web pages mentioning this, and I type it in UN resolution diabetes and look at the number. This is understandable because the San Vicente Declaration was signed way before the massification of internet, but there are this huge number of pages mentioning UN resolution diabetes, and that's amazing. Of course, we can compare with another hit, Cristiano Ronaldo. Of course, you cannot compete with Cristiano Ronaldo, that's for sure. But I'm sure that no one can compete with Cristiano Ronaldo on that sense. So thank you so much for listening.